I'm going to be your nurse today. And it looks like I'm also going to be taking over your case as your RN case manager. So it looks like you just met with a doctor, and it looks like you have a new diagnosis of rheumatoid arthritis. Is that correct?
Yes.
Alrighty. So it looks like you've been placed on some medications for that.
Okay.
Eunice, do you take any other medications at home?
I do. I carry them in my purse here.
Oh, wow, you are on top of it. Okay. So
I don't know what's in there. A lot of them
Sure.
are dad's, so I just take them because
Yeah.
he lived to be old, so I figured they'd be good for me.
So I see that some of these are vitamins, but I also see that some of these are prescriptions that are, looks like, in the name of your dad. So you and I are going to go through this, and we're going to see what you need to have, what you need to be taking, and then also it looks like what you probably need to not be taking as well.
Okay.
In addition to some of these medications, you now have that rheumatoid arthritis medication. And Eunice, I see that your blood pressure has kind of been trending high, and your doctor talked to you about that. It looks like he's prescribed a new blood pressure medication. Do you remember that conversation?
Yeah, is that hypertension?
Yep, hypertension.
Okay.
Yep. So that plus a lifestyle change of your diet, that's gonna help to kind of control that.
Okay.
Do you feel like you eat well at home?
No.
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 How often are you eating like cooked meals at home?
I don't.
You don't? Do you eat
No.
out a lot?
I do.
Okay. Okay. So with that in mind, I might looks like the doctor put in an order for a nutrition consult.
Okay.
So we're gonna have you meet with a nutritionist. Maybe you guys can kind of troubleshoot some ways to be cooking at home a little more, make that a little more easier.
Well, I just struggle a lot, and I know I mentioned that to the doc too, but I mean, it's just me, so there's no sense cooking for one, and I have a hard time with my hands, so
Yeah.
I just go out to eat a lot.
So let's see. Do you feel like you're moving well these days, Eunice?
Moving up on the elevator.
Okay. So you don't move so well. I know that you got the rheumatoid arthritis that can make that hands and wrists.
I sit at my job. I type a lot.
Okay.
And I live on the 7th story of my apartment building, so
Sure.
I take the elevator. I call those things, those car things, an Uber.
Yep. The Uber.
Uber. They're uber nice.
They are Uber nice.
They get me to McDonald's
Oh, right.
and back.
Good. Doctor's ordered, it's called a PT, physical therapy evaluation.
Okay.
Maybe just to see, they can assess how you're moving, maybe help you strategize ways that you can move a little bit easier,
Okay.
help your joints out a little bit. And I think that you also have, it's called occupational therapy consult, but let me just check really quick.
Okay. So are they gonna tell my boss to give me some time off? 'Cause I work a lot.
You work a lot? How many hours?
About 70.
Wow, that's quite a few.
Well, my dad, we worked on the farm. We worked a lot, so I'm used to working a lot. But that's all I do
Sure.
now. So.
Yep. Do you have family, Eunice, that's still alive?
No. My parents passed about a year ago, and excuse me. I moved up here to the city, so I just work and I did a lot of the accounting and paperwork on the farm there. So I got me a good job. I shouldn't complain. It's a good job, but I don't have any other things to do.
Sure.
That's all I do.
Eunice, I'd like you to just fill out this form for me. It's just gonna kind of tell me how you're doing day to day. Oh, where's your glasses? There they are.
These are my mom's.
Oh, they're your mom's. Okay.
Yep.
Do you feel like they work well for you?
Yeah, they get the job done.
Okay.
Okay, and what is this for?
So this it's called it's just a little assessment scale. Just it lets us know how you're doing day by day, kind of emotionally. Do you feel like you're excited to do things and able to get out of bed and things like that?
Well, I'm excited for McDonald's. It's almost lunchtime.
It is almost lunchtime. I do have a pen. Yep. So you just go ahead and fill that out.
Okay.
So while you're working on that, Eunice, so you're here because you're ready to kind of turn some things around.
Right.
So what areas of health do you feel like you're doing well in?
Well, I'm alive.
You are alive, so we can check that off.
But sometimes I worry about my weight. It does get a little hard to breathe when I'm sitting so much.
Sure.
And then I guess now I got that arthritis and that
Hypertension.
thing,
Yeah.
with the blood.
Yeah.
I don't know, I guess it's all new changes to me. I used to take care of my mom and dad, and
Right.
I just feel like it's all gone, downhill since them, so.
Yeah, when did they pass away, Eunice?
A little over a year ago, and I was the only child, so I just stayed there with them and tried to manage the farm and do what I could, and
Yeah.
well, now here I am, gave up a lot of things to take care of mom and dad, and but I should be thankful. They gave me a good life and raised me right and well, and
That'd be hard for anybody though.
so I guess that's where I'm at.
Okay.
In my
So Eunice, so you said some really good things that you're a hard worker and that you've had a lot of love in your life, with your parents. What things are you looking to improve upon with your health?
Well, I guess after talking to the doctor, I should probably change up my diet. Moving around would probably be good. I know with my arthritis now, that's why I've been in so much pain with my hands and my joints. And I'm lonely,
Yeah.
so maybe finding some friends to connect with would be nice.
No, it sounds like you're motivated and you're ready to start making some changes. So, with that in mind, it looks like we've got a physical therapy consult, a nutrition consult, an occupational therapy consult, and that should help with your hands a little bit, and then a psychological consult. So that's
Okay.
going to help with kind of your emotional and your mental health.
Awesome, all right. Well,
So,
thank you.
Yep. So we will meet back in looks like 2 to 3 months or so after you've kind of gone through all of those different consults, and we'll meet back and we'll see how you're doing then.
Hi Eunice,
Hi,
I'm Kelsey. I'm working with OT today. How are you doing?
I'm okay. How are you?
Good.
I'm Molly. I'm also going to be working with you today.
Hi, Molly.
How are you feeling today?
Okay.
Yeah?
Yeah.
Okay. So we were reviewing your chart and we see that you have a few things going on, but also that you have arthritis, and that's why your nurse referred you to us. Can you tell me if your arthritis keeps you from doing any of the daily things that you need or like to do?
Yeah, it does. It makes it really hard. I type a lot at my job, and I'm sitting a lot, and my hands just really hurt a lot of the times. I'm not able to do a lot of things at my own home as far as like opening like cans or jars. Sometimes brushing my hair, I feel bad. It's kind of frazzled today. It hurts. It's like a constant pain. So I do what I can.
Okay. How would you rate your pain during, let's say, brushing your hair or cooking? I'm on a scale of 1 to 10.
It's probably about a 6. It's constantly there. It's just a really strong aching pain, and then when I do move them a lot more, I kind of can get some sharper pains, but it's just a very constant aching pain.
Are you currently using any modifications or assistive devices to complete activities?
No, I'm not really sure what I could use.
Okay.
I guess I don't know if there are such things.
Yeah, that's something we can definitely talk about
Okay.
and try to figure out for you. So one thing that I need to know is just what are your goals for term in terms of your pain and abilities? What would you like to get out of OT?
Well, I would like to be able to do my job, and I don't know, it'd be nice to, I really enjoy like canned fruit, so it'd be nice to be able to open some jars and type at my computer for my job, maybe pick up the phone and dial some friends, so I think pain-wise, I could probably handle like a 2 or a 3, just where it doesn't bother me so much. I know a lot of times it just gets this numbing, aching feeling, and I don't know, I think I might better just chopping them off. But I don't know, I think I don't do a whole lot, so, just the things that I do, I would like to do without a whole lot of pain.
So we have a few ideas for your care plan, and Molly's gonna go through that with you.
Okay, thank you.
So I think it would be really beneficial to have you come in probably 2 to 3 times a week for the next 4 to 6 weeks. And
Okay.
just kind of teach you some exercises that you can do at home, just to kind of strengthen those muscles. Because the worst thing that you can do with arthritis is to stop moving.
Okay.
So we want to make sure that you're continually moving those muscles, and we'll teach you some exercises that you can do to strengthen, and ones that won't cause as much pain as you're doing
Okay.
right now. Another thing that we would go through is doing both passive and active range of motion.
Okay.
So teaching you how to do ones by yourself, and then we'll also do some where we're doing the movements for you.
Okay.
And then we would also kind of evaluate to see if you're a good candidate for splints. And those, we have 2 different kinds. We have like supportive splints that you could still do movements with, and so if you're opening a jar, or if you're gardening or typing, it's just gonna offer some support, and so you're not having to hold it the whole time. That might help. And we also have some other splints that you would just use like when you're sleeping, that you just won't move your hand. And it's just gonna keep everything kind of still from moving, and hopefully like decrease that inflammation. Would that be something that you'd be interested in kind of looking into?
Yeah, I mean, I'm open to trying whatever, can kind of help me day to day. Would be nice.
Do your joints hurt like if you're just laying down, or is it just when you're kind of doing movements?
More so, when I'm doing my movements. I know, I wake up in the morning and they feel okay, but then once I start doing those things, like brushing my hair, trying to brush my teeth, and getting dressed, those darn buttons, I only got one button today because it's just so hard, those little things. So, then I think it makes it a lot worse, makes it, kind of more painful, and
Yeah.
so.
One thing that we could look into as well is just getting some like assistive at home devices that you could use. So there's ones where we could help you get a device that helps you button, or Velcro's a good option.
Okay.
Where the buttons are like on the outside, but
Okay.
you just Velcro it. So those are some other options that we could look into for you as well. And then another thing that we would like to kind of look at and talk to you about is what to do when you have a flare-up. Whether you use a warm compress or like a cold compress, and just to try to alleviate that pain.
Okay.
And so that's other things that we'll talk to you
Okay.
when you come in during those 4 to 6
Perfect.
weeks.
That sounds good. I didn't even know those were options. I guess I don't know what to do. So I'm glad I got you ladies.
Yeah, and any questions you have, we're here to answer them and here to help you out. So if you have questions, like definitely please ask us.
Awesome.
And then do you have any, I know she talked to you about pain goals and like what you want to be able to accomplish, but do you have like any movement goals that you want to be able to still do, or you want to increase?
I used to do some pottery. I like to paint, and garden was always nice. When I lived on the farm, I don't live there anymore, but it'd be nice to be able to do some of those things. Maybe I could get like an herb garden going at my house and little plants. So doing those types of things would be nice to be able to get into, but some of those gardening tools are just, they're so small, I can't hold them without pain. So, yeah, it'd be good to get some of that back. I think that'd bring me some happiness.
And then your house that you live in, or do you live in an apartment, or where do you live?
I live in an apartment,
Okay.
so it's just me.
Is it one floor, or is it a couple floors?
It's a couple floors. I take the elevator.
Okay, perfect. Okay, and then has your nurse talked to you about nutrition at all?
She has. So,
Okay.
Yep.
And nutrition is a big aspect of arthritis, and it's gonna really help your progress here in OT as well. So I would definitely suggest meeting with a nutritionist as soon as possible,
Okay.
and we can collaborate with them as well. if you need to
Sounds
be.
great.
Alright. Do you have any questions, Eunice?
I think I'm good. Do I make appointments with you or the receptionist out front? Or
We'll go up to the front and get you set for your first appointment, and
Okay.
then from there she can talk to you about
sounds
when to
great.
schedule it. Okay.
Okay. Thank you so much, ladies.
All right.
You're welcome.
Hello, Eunice.
Hi.
How are you today?
I'm okay. How are you?
I'm good. I'm Sydney. I'm your nutritionist.
Hello, Sydney.
So I'm gonna go over some basic dietary guidelines and then ask you some questions about your diet. Is that okay?
Yeah.
Okay, sounds good.
So the USDA has a basic outline for people to follow, and they have different serving suggestions for people at different ages and everything. So looking at your chart, I put together some information for you. Before I do that, can I ask you about how many servings of each food group you have each day? Do you have like a rough estimate?
Well, I keep McDonald's in business.
Okay.
I think I go there probably at least 5 or 6 times a week. I don't eat a whole lot of fruit or anything.
Okay.
I have a hard time, opening cans and jars and stuff like that. So I try bananas, but a lot of times I just end up squishing it.
Hard to open.
I guess I got the lettuce and the tomato on my Big Mac. So I used to eat better when I lived on the farm. We gardened, but the past year since living here, I just eat what's convenient.
Okay. In terms of drinking, do you drink milk or pop or water? What's your choice of beverage?
I start each day out with some coffee. I like my coffee. Then usually I have a couple sodas when I'm at work there. They have a pop machine, so I go get some of that, and that's usually before I take my lunch, and then I go to McDonald's and I get a soda there.
So, according to the guidelines, you should be having around 4 to 5 servings of fruit, and around 4 servings of dairy, so that could be milk or yogurt or anything like that. 50 grams of protein, 6 cups of veggies, and 16 grams of grains. And we can definitely discuss further at further appointments different options to get those to you, since I know eating can be kind of difficult with your arthritis. So I'm going to ask you some questions about your diet.
Okay.
What foods do you like or dislike or prefer?
I grew up on the farm, so if it has 4 legs, sometimes 2 with chickens, I'll eat it. My dad always said waste not, want not, so we ate everything. I like carrots and I like fruit. My mom would always make really good fruit pies. But if it's there, I eat it. So corn, we grew corn and potatoes. I'm a meat potato kind of girl. But yeah.
Is there any food you try and stay away from?
Eggplant.
Eggplant?
I don't like eggplant.
Got it. And you said you grew up on a farm?
Yep.
And you, can you tell me what you would eat on a day-to-day basis when you were living on the farm compared to what you eat now?
Well, growing up we had cows, so we'd milk them every morning. We'd have the fresh milk there, and they would use that to make butter, and we'd have that heavy cream. That was good, put that on everything. And we had the pigs, so we'd butcher those, and we'd eat some pork. And then we had some steers, we'd kill those, and we'd have some beef. I don't have access to that. I just have, old McDonald's there. That's a joke about old McDonald having a farm.
So you eat fast food on the weekends as well? Or what do you do? Okay.
I like Perkins.
Perkins?
Yeah, they have really good breakfast. And I have breakfast for lunch and supper sometimes.
Okay. Ever tried making any changes to a healthier diet since you moved to the city, or has it been strictly fast food? Or
Well, it's just me. I don't have anyone else since my parents died, so it's hard to cook for just one. And then the problems I have with opening things. Even some of those packages, trying to get that seal off. I don't have time for that. So
yeah.
I just grab what I can. Jared, he goes to Subway and walks there. I don't want to walk, so if I can just drive in and go, I'm good to go. That's my mode.
Okay. So looking into the future, what are some long-term goals you have for your nutrition? Would it be better meal choices or smaller portion sizes?
Well, I'm not getting any younger. I was reading, where'd my glasses go? I was reading this little pamphlet here about nutrition, and I don't know, it looks like maybe I'm gonna be at a risk for diabetes or something if I don't take better care of my health. So I should probably look into that type of stuff here and getting some healthier foods I don't know, maybe double the lettuce. Whatever I need to do to make life easier, I'll do it.
Okay, so looking at your history, I see that you have hypertension as well as arthritis.
Yep.
And so the fatty foods you're eating can definitely cause further problems with those. And like you mentioned, diabetes is another risk factor.
Okay.
So it'd be a good idea to try and cut back on the fatty foods. And I know you mentioned cans are difficult to open, but there are like fruit cups and like whole veggies that you can buy and prepare. Or services like Meals on Wheels could be helpful. I could help you get set up with that.
Oh, good.
And
That'd
then
be good.
I was talking with your occupational therapist, and they said you have a hard time with your hands.
Yes.
So
Yep.
assistive devices can be very helpful with
Oh,
that.
they got those for nutrition too?
Mm-hmm.
Awesome.
Yep. So starting with small changes and exercising. I know you said you're sitting at a desk, so maybe getting an exercise ball to sit on, or
Okay.
getting little pedals to put on your desk. You can pedal while you sit is a good idea. And then celebrating your successes is also another way to stay motivated. So,
I motivate myself with a Snickers in the morning.
well, that can be a nice little treat every once in a while.
Well, you know, the advertisement says hungry, grab a Snickers, so I'm a hungry person, and they're easy to open, they're there, so.
Very true. Well, we can get you set up with another appointment at the front desk. So it was nice meeting with you and getting to know your background.
All right, well, thank you, Sydney, and this will be good. I like food, so let's get started.
Hi, Eunice. My name's Katie.
Hi, Katie.
I'm one of the psychiatrists here. Have you ever been to a place like this before?
No, but it's beautiful.
Thank you. So what we do here is we focus a lot on obviously mental health, and that's kind of why you were referred here. So what we do is we really try to incorporate the best way we can treat for stressors, cognitive and emotional kind of coping issues that you might have.
Okay.
So it doesn't necessarily always mean that we prescribe medications if that's not what you're interested in, but providing you with some solutions or strategies to kind of cope with whatever it is that you're going through, so whatever that may look like. So is there any way you'd be willing to tell me a little bit more about yourself and kind of history and where you came from and what you do for a living?
Yeah, no, okay, so, well, I grew up on a farm with mom and dad. They passed about a year ago.
Okay, I'm sorry.
And you know, I was an only child, and so I took care of them until they went
Okay.
to see the Lord.
Okay.
So that was kind of tough on me, but I'm in the city now, so I have an apartment, and you know, it's just me.
No pets?
No,
Okay.
no pets. I just, you know, it's kind of, I guess I don't know. I don't have a whole lot in my life right now.
Okay. So what do you do for work?
Work for a real estate company. I do actually a lot of the telemarketing stuff. So
Okay.
you know, I answer some phones. I type a lot.
Okay.
And I'm there. You know, I get about 70 hours in a week.
Wow, that's a lot of work.
Well, you know, I grew up on the farm. We work hard, so I just keep plugging away.
Okay.
So
So you do a lot of like administrative work, okay?
yeah.
So you have a lot of long hours, it sounds like. What is there? Do you have any hobbies or anything you like to do in your spare time, or any people that are important to you that you like to visit?
No.
You don't have any sort of hobbies?
No.
Okay, I suppose you don't have a whole lot of time.
Well, you know, I used to when
Okay.
I lived on the farm. You know, we gardened, and I liked pottery. Painting was fun. There was a tree in our backyard. I used to paint it all the time. When the
Okay.
seasons would change,
Mm-hmm.
it changed up how the
Okay.
tree looked.
Mm-hmm.
But I left those actually at the old farm place.
Okay, thank you for sharing that.
Kidding.
So is it okay if we dive into some of your medical history, and did you happen to bring a list of medications you're currently taking?
I did. I gotta reach here. These are my mom's glasses.
Okay.
They help a little. All right, I think this is the right one. So I'll hand that
Okay.
to you.
Okay. So is this something that you wrote up yourself, it looks like?
Yeah,
Medications?
yeah.
Okay.
I don't know what they are. I haven't been to a doctor to get any. Those are just what my dad was taking.
Okay.
So
did you happen to bring your medications so we could maybe like
I
take a
did.
look
I
and
got
see
those
what-
too. So
Oh, okay.
here's my bag.
Okay.
I just threw them all in there, so I don't really know.
Okay.
But I figure if he was taking them and lived to be 97, I should be good to go.
Okay. Well, we'll definitely have to tackle that. I'll leave that there for now. We can kind of discuss that in a little bit.
Okay.
Do you have any sort of health concerns that you're worried about? I know that your primary doctor had referred you to me. So, what have you been seeing as far as health concerns that you would like addressed, and how do you think that kind of correlates with why you're here? to see
Well,
me?
you know, since my mom and dad died and I moved here, I haven't been doing much but working and eating. And I met with a nutritionist,
Okay.
and they talked about eating healthier. So I'm drinking my core water here, working on my core.
That's a good start.
Yeah, and let's see, I met with the occupational therapist.
Okay.
So they talked about exercise and doing things to help my arthritis. So I'm trying to do some of those things. I guess I'm just lonely, you know. I was saying before, it's only me, so I don't cook a lot of meals. I go out to eat a lot by myself. So
Okay.
I guess I'm kind of sad.
Okay. I noticed that you also brought the eval from your primary doctor, and it looked like you had kind of a mental health screening done. That was just a very brief one. So do you feel as though you are looking to get treated for depression, or are you looking for some strategies maybe in how to deal with that?
Yeah. Is that what I got? I got depression?
I mean, according to the eval, what I'm looking, it could be something along those lines. So, depression is kind of a vague diagnosis. It can be very severe, it can come in waves, and it can also kind of be very absent for a very long period of time and then come back. So, everybody experiences depression very differently. Some people do take meds to treat it. Other people look towards their interests or therapeutic interventions like aromatherapy, painting, like what you were mentioning. So
okay.
maybe some of those things we could talk about as think of those as kind of treatment options that we could maybe start with.
Well, I'd like that.
Yeah,
I'd
okay.
like to find some friends, maybe a painting group or a planning group or
definitely.
any kind of group, really.
Yeah, let me just take some notes here. There is a really awesome art group that is in Minneapolis. Are you familiar with that area at all?
A little. I don't get around much. I don't drive much.
Okay. Well, maybe we can. There are plenty of resources at the front desk that I can maybe give you. There are a lot of art therapies that we provide, as well as, again, a medication route and then also therapeutic route. So I think that a good start would be we're going to tackle these meds and kind of see what you're getting treated for. It sounds like you're taking things that actually were prescribed by other people, so that is an issue that we will need to discuss.
Okay.
But we're also going to talk about how we can make the depression, the signs and symptoms of depression, feel alleviated here. But in the meantime, it looks like I have a few different resources that we can look into some art therapy, maybe get you interacting with some more people, and maybe that can start to help you cope with this depression that you might be feeling. So does that sound like an okay thing?
Yeah, you know, I told the girls in my nutrition and my other therapy, I'm open to, you know, whatever works and whatever I need to try. So
Well, awesome. That's definitely the first step, is just being willing to try new things that can help you and benefit you. So
okay.
in the meantime, what I'm going to do is I'm going to request some lab work to get done. So I'm not going to prescribe anything for you aside from just getting those pamphlets of the art therapy for you. and I'm gonna have you get some lab work done to see where your levels are at because of the medications that you've been taking. Does that sound like it's a reasonable
Okay, so I
thing?
shouldn't have been taking those even though,
No, definitely not.
Okay.
So the lab work will definitely give us a baseline of where all of your levels are at as far as the different.
so do you think
tests that
those
we
have been making me sad?
There's a possibility that could have that effect. So
Okay.
in the meantime, I would say, continue to take multivitamins, things like that are going to benefit your health. And if there is anything that is not prescribed to you, I'm asking maybe we don't take that.
Okay.
Okay, is that something we can agree on?
Yeah.
Okay, so then the only other thing again is the lab work. So I'm gonna write down, I'll leave these right here for a second. I'm gonna write down all the different labs that we need to get done here. And we can see you back in a month. So there's that. You
Okay.
can bring that to your lab. And then we'll see where your levels are at and we can kind of go from there.
Okay.
And then I can give you these here.
Oh, well, thank you so much.
All right, well, thanks for coming in.
Thank you.
We'll see you in a month.
All right, sounds great.
Hi Eunice, how are you doing today?
I'm doing better. I'm doing really good.
Good, yeah? Yeah, you've lost some weight since I saw you a couple months ago.
I have 10 pounds.
Look at you.
I met with nutrition and we got some changes going and I'm just
Yeah?
feeling alive.
Okay,
Yeah.
that's good to hear.
I'm drinking V8 now.
Look at you.
I know.
Okay.
I get all my vegetables in one can.
Wow.
I didn't even know they made that. I don't know how they do it.
I'm glad to hear that you're doing better. Wow, okay, so let's kind of talk about what you've been doing the last couple months since I saw you. So, you talked about nutrition.
Right, yep.
How's that going?
Good. We looked into a Meals on Wheels program. I didn't really qualify because
Probably a little
I
young.
don't know what the standards really are, but
Okay.
but we looked at other alternatives. So I'm trying to find fruits and vegetables and things that don't require the openings. Trying to get some more fresh fruits. So eating some raspberries, strawberries, things that I don't need to open out of a can or get out of like the tough plastics. So that's been really great. And they have some devices that I got from OT that help me as far as
good.
eating.
Okay.
And so that's been helping me a lot. So I just feel like I'm making some better choices. I'm trying to pack my own sandwiches now for work.
Good.
So it doesn't smell like French fries anymore at my desk. Kind of miss those, but
Yeah, I know it's hard, isn't it?
it is hard. I used to dip them in my milkshakes that I get there
sure.
now. So I do crave that once in a while. But the weight loss doesn't lie. I'm looking good, feeling good. I met some friends.
Yeah, through art therapy?
So through art therapy, yeah.
Okay.
So we've been painting up a storm. I mean, literally a storm. It's a great picture. There's some clouds in the background.
Yeah. Okay.
Yeah, it's been fun. It's been nice having people back in my life.
Of
So
course. So how often are you going to art therapy, Eunice?
I actually go once a week.
Okay.
And so it's every Wednesday. That's what I look forward to. It's in the middle of the week. And so we get together. I met some friends there. There's Mabel and then Harry. Harry's a hoot. He likes V8 too. He got me started on that actually. And then I asked my nutritionist and they said that was good. So
Wonderful.
but it's been good. Yeah.
Okay, wonderful. Eunice, I've just got some papers here. I'd like you to fill out this. You filled it out earlier. It's
Okay.
just that kind of depression scale. I would
Okay.
just like for you to fill that out really quick. We're just gonna
Okay.
compare it to your baseline.
Okay, sounds good. Do you see I'm not wearing my mom's glasses
I
anymore?
see that.
I'm not taking my dad's medication anymore.
Yeah.
Apparently those things were bad for me. I didn't know.
Mm-hmm.
You know, it was there. We grew up on the farm. We made
Right.
use of everything we had. So I
Of course.
figured it was there. Might as well use it. We paid for it, right?
I know. Well, I'm glad to hear that you're taking only what you need to be taking now.
Right. And those. I think that's that.
Okay. Thank you.
That arthritis medication has really been helping kind of keep my flare-ups. Now I guess that's what they were called, was flare-ups. I thought it was hot flashes, but that's menopause, so I don't know. I suppose that's right around the
Sure.
corner too.
I suppose. Yeah.
But yeah, though that's been helping, and my diet. I had some lab work done for my hypertension. Remember that, and my numbers aren't where they need to be quite yet, but they're getting there. They're getting
Good.
lower, so
Good.
I feel like Eunice is going up.
I'm glad to hear that, and it looks like it too. So
And
I'm
not just on the elevator.
good. I'm glad to hear
I
that.
tried using stairs the other day. It was really slow, so I still stick to the elevator. But I'm working on
I'm
it.
proud of you, Eunice. That's wonderful. So it looks like, so according to your, we saw you about 3 months ago. Your scores have dropped for your depression scale, so that's awesome. So it
Good,
looks like you're, numerically, it looks like you're feeling better.
I think I am.
Mentally.
Yeah.
Okay, wonderful. So Eunice, like, health is this dynamic thing. So it's great that you're feeling better, and I'm really proud of you for all the progress that you've made.
Thank you.
But we have to continue to strive for like the good, eating the good vegetables and fruits and stuff like that, and walking and trying those stairs. So I mean, your team wants to walk alongside of you to make sure that you're feeling and doing your best.
Awesome. Well, I got a great group of ladies, so whatever we want to tackle, let's just tackle it.
All right, sounds good, Eunice.
Perfect.
I'm really proud of your progress.
Well, thank you so much, and it was good meeting with you again today.
Of course.